Greedy doctors and social media influence. 65% of you said that's what's behind this newest facelift trend. We're looking at it today. So what are the millennials doing now? This controversial trend has the plastic surgery world divided and the average layperson somewhat horrified. Are plastic surgeons getting greedy as the free money dries up and the competition for $60,000 procedures skyrockets? Or is this trend indeed in the best interest of the patient? After this short video, I really want your opinion. What do you think? So put them in the comments section below. Facelifts in the 30s? Well, according to the American Society of Plastic Surgeons' latest statistics report, patients aged 30 to 39 underwent a total of 2.1 million cosmetic procedures in 2020. 364,000 were surgical, so could be body, could be face, and get this, a small but growing, and I mean growing, number of millennials are now opting to go underneath the knife for facelifts and non-invasive treatments. So not just non-invasive like fillers and toxin, but surgical deep plane facelifts. That's right, you heard me, facelifts with their Botox and fillers. Although the procedure was once believed to be the most appropriate for people in their 50s and 60s, today the surgery is increasing in popularity with patients in their 40s and even 30s. So why are more millennials seeking facelifts, you may ask? When millennials begin to notice the first signs of aging, they flock to offices like mine for that magical elixir. They do not want to age. It's as if they absolutely fear aging, and indeed it doesn't seem valued in our society, I must say. The rise of widespread social media with the new platforms every few months, Instagram, TikTok, Facebook reinventing itself, who can keep up? But these absolutely create intense preoccupation with appearance, in my opinion. And these people are making money for it. Of course, people don't want to go back to work when you can make money off these platforms. Think OnlyFans. People make millions. Plastic surgeons believe that this phenomenon will continue to gain momentum in the foreseeable future, so they don't see it drying up. In cities like New York and LA, there can be a third of facelift patients within a practice in their 30s. Millennials base their decisions on social media and pick their surgeon based on his or her social media presence and those dreaded before and afters. Yes, a single great before and after of someone who's in their 50s and looks 30 or even younger can float around the internet and give that perception that that's the result that they'll expect every time. Despite the notion that the 30s may be too young, having at least 1 centimeter, yes, 1 centimeter of pinchable, lax skin in the lower face or neck technically makes someone a candidate for a facelift. That is a metric that's talked about. Imagine, so it's 1 centimeter. 1 centimeter, I can push probably 2 centimeters. So it's 1 centimeter is the metric, and then you say, yeah, then you can have a facelift. The whole concept about when and why to have a facelift has changed. Instead of needing one, and I use the word needing one because people use that word, people want one now. Now people recognize that a conservative facelift or a mini lift can be performed as a maintenance procedure at the first sign of noticing just some laxity. Think RBF. I have people come in the 20s for this downturned mouth. Rather than waiting for their skin to droop and wrinkles to deepen, many millennials are choosing to undergo facelifts as a preventive measure. And there's the key word. Is it preventive? They want to continue to look like themselves and not age. Many of these doctors are also highlighting the shortcomings, of course, of minimally invasive fixes to prove their point. Things like devices, fillers, and threads. And they're saying, well, they don't work, so you should get a facelift. Just get a facelift. Certain doctors find non-invasive tightening procedures to be largely ineffective. Some of the scare tactics that are used are that a facelift may not be possible down the road if you do threads or if you do Sculptra or Bellafill or certain things like that, and saying that fillers, when you dissolve them, change the smaz or the deep plane in the face. There's a lot of fear out there. I'll place a link below of an interview I actually had with 2 Beverly Hills plastic surgeons who completely refuted this concept, and you can watch that for yourself. Keep in mind, the most scar tissue is produced by what? Not threads or Sculptra, a facelift. A facelift produces the most scarring in the face of all these procedures. You're cutting, dissecting the tissues, and moving it back. As well, many younger clients are moving away from the telltale signs of too much filler. This can distort the features, certainly I agree, especially those of expression. This appearance, of course, we nicknamed the pillow face, and you all may know it. It gives that doughy, unnatural, bloated appearance to the skin. The false concept that fillers promise to lift the skin is an issue I agree with. Fillers don't lift. They contour, they create shape. Biostimulators, however, will tighten and can create lift. Think Sculptra and Easy Gel. RF microneedling will tighten the skin. I see it every day in practice, but patient selection is key. It's not a facelift. Still, not every expert thinks you should pull the trigger and go for surgery. So while there's a group that are saying, yeah, do it in your 30s, there are so many great non-surgical techniques to achieve facial rejuvenation. That says Dr. Rajani. He's a friend and colleague of mine. Very reasonable, great guy. And that's what he said in an interview with Bizarre. While lasers, Botox, and fillers are no substitute for a facelift, women who use them in preventive ways do not seem to age quite as much. And I find that to be a true statement too. What's more, there can be a downside to hitting the OR too early. He continues, the more surgery you have, the more you risk looking like you had, quote unquote, work done, he says. And then there's Dr. Diamond, another great guy, great surgeon, very reasonable, great point of view. He's one of those guys that you should listen to. He says that surgery, quote unquote, will be really obvious if you wait until later. And by doing it younger, you do it subtly, which gives better results. Coming from Dr. Diamond, I like that point, and I think it is something we need to look at and really think about for selected patients. And I think, of course, that's what Dr. Diamond was referring to. However, plastic surgeons who realize many do not want a $60,000 procedure and are very happy with what I call tweakments quickly adopt things like threads, devices, skincare, etc. The argument that these things do not last would mean they would never offer Botox or even skincare in their clinic. Both of these things need maintenance. Applying sunscreen, it needs maintenance every few hours, in fact. So what does longevity really mean? A facelift on average, even if it's a full deep plane 6-week to 6-month recovery, lasts at most 10 years. Although many people are falsely led to think that it's permanent. And what is a facelift without removing brown spots, plumping the lips a little, removing reds? So it all works together. Otherwise, it just looks like a pulled face. And then there's bone. You have to mimic bone. So it's not all one thing. In the end, do you think this is all crazy? And the kids are getting carried away with the quest for perfection, seeking out surgeons who are willing to remove 1 centimeter? Or is this the reality, the new norm, and we need to adopt and adapt? If you have millennial kids, are they seeking this? Are they wanting to be influencers, YouTubers? Are they talking about plastic surgery, fillers, and Botox? Hit me with the comments below. I really want to know what you think on this. Stay tuned. Keep your skin and body beautiful, healthy, and vibrant.